You're able to see the quiz questions, all of you. No, the screen you are able to see. All of you are able to see or not? That is what I want. Okay. So the quiz will be conducted for about an hour, and it will have only one round of 40 questions. Okay, all of them will be multiple choice questions, and you will have to pick the ABCD, whatever is your choice. Okay. So and you will have a timer. Okay, okay. So for most of the questions, the time will be 20 seconds. 20 seconds for each question. But for some questions which are very lengthy, after my presentation of the question, it will be for 30 seconds. Okay. So we'll take the extra 10 seconds. My watch will tell. Okay. Or you can tell. Okay. You can start the timer for 30 seconds for those questions. Okay. Yes. Bashir bhai, start. Okay. If anybody is not able to get the scanner, please come to Bashir. He will help you. Hope all of you are ready. Okay, let's start the quiz. Timer he will tell for all the questions. For long questions. Okay, so four choices. Yeah. Okay, okay, okay. So here comes the first question. Question number 1. Which of the following myotics are direct acting parasympathomimetic agents? Here are the options. One is ecothiopate, 2 is carbachol, 3 is demicarium, 4 is pilocarpine. Out of these 4, 1 to 4, anything could be the combination of direct acting parasympathomimetic agents. You have to identify the combination. Option A is 1, 2 and 3. Option B is 1 and 3. Option C is 4 only. Option D is 2 and 4. Your time starts now. Time is up. Okay. How many responses have been recorded? 66 members have responded. Okay. So here is the answer. Option D, 2 and 4. Okay. Yeah. Here is the question number 2. Which Amsler's grid charts is used in evaluation of the optic nerve diseases? Option A, chart 2. Option B, chart 6. Option C, chart 7. Option D, chart 3. Please don't bother about the small letters. Okay. So your time starts now. Already started. Time is up. Time is up. How many have responded? 36 only responded. 45. Okay. 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 And the answer is option D, chart 3. So match the following. Option A is Allen test card. Option B is uh, K chart. Option C, the third one is LEA symbol chart. Okay. So match the following. Okay. So option A, for A it is B. For B it is small letter A. For capital C it is C. Okay. So for option B, option A is for small letter C, option B is for small letter B, and option C is for option A. And option C is, let me complete the question. Okay, so option A is A, option B is B, option C is C. So and the option D is for capital A, it is small a, for capital B, it is small c, and for capital C, it is small b. Match the following. Your time starts now. Already 63 members have given, but anyway, let us wait for the rest. And here comes the answer, option B. Okay. So for capital A it is C, capital B it is B, capital C it is A. So Allen test cards are option C, and B is for B, and K charts is this, and for C it is A. The Lee symbol chart is option A. Name the organism. The options are option A, Fusarium, option B, Candida, option C, Aspergillus, and option D is Pythium insidiosum. Your time starts now. Thank you, Bashir. Time is up. Here comes the answer. It is option D, Pythium insidiosum, parafungus which causes severe keratitis resembling fungal keratitis. And these are actually like a plaque. You can actually remove them from the surface of the cornea. Okay, that is the treatment most of the times, along with your antimicrobial. So what is the diagnostic test performed here, and identify the diagnosis? Option A is, it is specular microscopy, and the diagnosis is bullous keratopathy. Option B is confocal microscopy and microsporidiosis. Option C is confocal microscopy and the diagnosis is acanthamoeba. Option D is specular microscopy and it is Fuchs endothelial dystrophy. Your time starts now. What is the diagnostic test performed, and identify the diagnosis? Time is up. How many, Bashir bhai? 51. Okay. So, and the answer is, it is confocal microscopy and the diagnosis is microsporidiosis. Question number 6. Which class of anti-glaucoma medication acts through modulation of tissue matrix metalloproteinases on the ciliary body? Option A is beta blockers, option B is carbonic anhydrase inhibitors, option C is prostaglandin analogs, option D is Rho kinase inhibitors. Your time starts now. Which क्वेश्चन नहीं आ रहा है मोबाइल में? अब आ गया कि नहीं? Yes? Your time starts now. Did you enroll? Come here. Still 34 questions are there. Last time when we conducted the general quiz, the highest scorer got 28 marks. Okay, so don't bother much about anything. Scan. Your time is up. Of course, sorry, the questions time is up. I am not Balaya to tell like that. Okay. Yes. Okay. 20 seconds. No, now nothing can be done, madam. So the answer is option C, prostaglandin analogs. Now let us go to the question number 7. Name the binocular suprathreshold visual field testing method used to assess visual field disability. Option A, Esterman visual field perimetry. Option B, Goldman perimetry. Option C, 30-2 Humphrey visual field perimetry. Option D, none of the above. Name the binocular suprathreshold visual field testing method. Your time start. Does the timer appear on your mobile? Yeah, that's good. Time is up. And the answer is option A, Esterman visual field perimetry. And here is a long question. You have to start the timer for 30 seconds. Can we change it to 30 seconds? Pura 1 minute is there. Okay. So we can stop it. Okay. Okay. So for that 40 seconds we can keep it for this question. Okay. So here comes the next question, which is quite a lengthy question. Identify the diagnosis of all the four pictures in sequence. So from right to left, you have to match with the options. Option A, the first one is branch retinal vein occlusion. Then comes the central retinal vein occlusion. Then PDR. Then AION. Option B, it is branch retinal vein occlusion, the first one, and second one is non-ischemic CRVO, then the third one is vitritis, then the fourth one is papilledema. Then option C is hemiretinal vein occlusion, and then second one is CRVO, and then third one is preretinal hemorrhage, and fourth one is diabetic papillopathy. And option D is hemiretinal vein occlusion, and for the first one, and second one is CRVO, and third one is vitreous hemorrhage, and fourth one is diabetic papillopathy. Your time starts now. No. The time to read the question will not be considered. Okay. So your responses will come. Okay. So whatever it is, if you okay, already given. Okay. Responses were already given. Even now responses are coming. 52. Time is up. The answer is option D, hemiretinal vein occlusion, CRVO, vitreous hemorrhage, and diabetic papillopathy. Look carefully at the diagrams. You can see the first diagram having almost hemi-retinal vein occlusion, and then the central retinal vein occlusion, and vitreous hemorrhage is there in the third diagram. And the fourth one is diabetic papillopathy. It often mimics any optic disc edema. Okay. Yes. So question number 9 is also longer. Identify the diagnosis of all the four pictures in sequence. Option A, myelinated nerve fiber layer, neuroretinitis, CSR, Pusher retinopathy. Option B, CRAO, optic neuritis, CSR, hypertensive retinopathy. Option C, myelinated nerve fiber layer, neuroretinitis, CSR with optic disc, Pusher retinopathy. Option D is myelinated nerve fiber layer, neuroretinitis, CSR, and HIV retinopathy. The timer has already been started. The first one is, it appears obvious. The real difficult ones are the third one and fourth one, I believe. Sir, please, so one of you can take the seat. Time is up. These option is the answer slide is not there. Okay, so the answer is option C. Okay, so myelinated nerve fiber layer, neuroretinitis, CSR with optic disc pit. Actually, it is not CSR with optic disc pit, it is retinoschisis. Previously, we used to think when we were postgraduates, we used to present it like a CSR, but the OCT, the evaluation of OCT has revealed it to be a retinoschisis actually. Retinoschisis that happens with optic disc pit. Okay, and then fourth one is Pusher retinopathy. That is the answer. So, and here comes the question number 10. Look carefully here. Identify the involved muscle. Option A, right superior oblique. Option B, left superior oblique. Option C, right inferior oblique. Option D, left superior rectus. Your time starts now. Time up. హాఫ్ మినిట్ ఉందా ఇంకా బాగా డిఫికల్ట్ క్వశ్చనా ఓకే ఓకే టోటల్ క్వశ్చన్ ఈజ్ 1 minute. Okay, from the starting. Okay. It's okay, okay. Even if you give longer time, many people will fail. Because we used to have a bunch of students in our batch who always used to fight for the postponement of the examinations. Okay, so they always and they even uh, what do you say? Uh, they signed on behalf of us and gave the letter to the registrar of the university at one time. Okay, we will be boycotting the exams. Was written in the. Okay, such terrorists we used to have during our days. Okay, now terrorists are rare. The answer is left superior oblique. Option B. Look carefully here, left superior oblique. Okay, so right, red is for right. So right is always there in the correct position. So it is the defective one is the left one. That is simple. Okay, and it is the superior oblique. That is why you can see all the inferior. See, most of the times the fourth nerve palsy people find it difficult to take down the stairs. Getting down the stairs is very difficult for them. Question number 11. Best treatment options are 5-year-old patching failure, visual acuity, optic is right eye is 20 by 20 and left eye is 20 by 30, and cycloplegic refraction is right eye plus 5.5 sphere for the left eye plus 3 diopter sphere. And stereo acuity without correction is 3000 seconds of arc. Only the kid is able to identify the uh, uh, fly wings only. Okay, nothing else. So here are the options, and alignment is orthotropia for distance and near. Here are the options. Option A, full correction for right eye and penalization for left eye. Option B, partial correction for right eye and continue patching for left eye. Option C is penalization for right eye and full correction for left eye. Option D is full correction in both eyes. Completed. 67 members have already responded. Here is the answer. Option A, full correction for right eye and penalization for left eye. That is the option. That is the correct option. Question number 12. Vitritis is a prominent feature in option A, acute multifocal placoid punctate epitheliopathy. Option B, punctate inner choroidopathy. Option C, birdshot chorioretinopathy. Option D is progressive outer retinal necrosis. Vitritis is a prominent feature in. I hope all of you have got the question in your mobiles. Time is हो गया और 18 seconds are there. Actually, the timer works for 1 minute from the starting of the slide. The timer works for 1 minute total. Over. 80? 82 people have responded. Okay. So, and the answer is option A, AMPPE, acute multifocal placoid punctate epitheliopathy. Question number 13. In internuclear ophthalmoplegia, identify the correct statement. Option A, diplopia is not a problem. Option C, convergence is normal. Option C, the lesion is ipsilateral to the eye with the abducting nystagmus. Option D, multiple sclerosis is most common cause in the elderly. This is a pretty easy question, provided you know what is INO. बशीर भाई टाइम हो गया कि नहीं? Okay. Good afternoon, Rajesh. Welcome, please be seated. and the answer is B. Convergence is normal. So convergence is normal in usually unilateral internuclear ophthalmoplegia, and convergence is absent in walleyed bilateral internuclear ophthalmoplegia. That is Webino syndrome. When both sides, the medial and longitudinal fasciculus connecting the sixth nerve and the third nerve, if they get disrupted, then you get an obvious exotropia, walleyed bilateral internuclear ophthalmoplegia. And we reported 2 cases long back. And question number 14, lenticular intrastromal keratoplasty is done to correct option A, high astigmatism, option B, post-classic ectasia, option C, high hypermetropia, option D, high myopia. Lenticular intrastromal keratoplasty, like is a term, mnemonic for this abbreviated form. Hope all of you like the question.
They will like if you tell the answer.
Okay, that I will tell after 1 minute. That is a 1 minute job for me. From this question, my questions appear. All the previous questions were not prepared by me. If any question goes wrong, I don't say I am not responsible, but like in a house, the wife is always right. Like in any quiz, the quiz master is always right. Okay. Yes, the time is up. Whether you like it or not. Most of you are females, you don't like it. I know it. Okay. But the answer is high hypermetropia. High hypermetropia. Okay. So this uses the femtosecond laser and uses the corneal lenticules that are taken out in the SMILE procedure. Okay, so they will be introduced into the they will be fashioned again and according to the situation, and they will be, or you can take it from the donor corneas also. Okay, and do it. Question number 15. Ocular manifestations in Parkinson's disease include all of the following except option A, blepharoconus, option B, blepharospasm, option C, relative afferent pupillary defect, option D, infrequent blinking, which is not seen in Parkinson's disease. Medicine is always about there is never a never and there is never and always. Okay? Yes. Usually, most commonly, sometimes, less often than not. Okay? All these terms we are used to.
Not uncommon.
And the answer is option C, relative afferent pupillary defect. The pupils are relatively less affected in Parkinson's disease. Okay, unless the disease is very extensive or something like that. Okay, usually the blepharoclonus, blepharospasm and infrequent blinking, they all are seen. Okay, actually I thought to include blepharotosis. Okay, so it would be rhyming, no? Isn't it? But when I checked the Google scholar told blepharotosis also occurs in Parkinson's. So you learn when you prepare. Okay, not that you know everything. Don't think that the quizmaster knows everything out of your syllabus. A double layer sign on vocity macula is not seen in option A, type 1 CNV, choroidal neovascularization. Okay, option B is type 2 choroidal neovascularization. Option C, polypoidal choroidal vasculopathy. Option D is choroidal metastasis. So the double layer sign, if you know what it is, okay, it is not seen in. So it is seen in 3 out of the 4 and it is not seen in 1. So what is that one? See, the retina, somehow after the OCT we could understand more about the retina and the choroid. But the cornea is obviously available for every investigation possible, and you are able to see up to 800x resolution you can image with a confocal microscopy, and still you don't know much about cornea. Time is up. Okay. Yeah, option D, choroidal metastasis is the answer. Question number 17. In Irwin gas syndrome, cystoid macular edema begins in which retinal layer? I hope all of you know about this Irwin gas syndrome, the cystoid macular edema that occurs after a cataract surgery and more often leads to a frustrated surgeon and an unhappy patient. The edema starts in which layer? Option A is outer plexiform layer, option B is outer nuclear layer, option C is inner nuclear layer, option D is nerve fiber layer. Where does the edema start? We all know edema is there, but where did it start?
You should give some clues.
I don't have a clue myself, doctor. I prepared the question and I forgot the answers. That is the problem. Short-term memory loss after a tonic. Okay. And the tonic was imported one. That's the problem. So even with the native ones it is happening, and with the imported ones also it is happening. Option C, inner nuclear layer. So it starts in the inner nuclear layer. And the next question is very, very important. Question number 18. Plasma half-life of indocyanine green dye is option A 2 to 4 minutes, option B is 20 to 30 minutes, option C is 1 to 2 hours, option D is 6 hours. Your time started already.
Give a clue. It's more than fluorescein or less than fluorescein. Give a clue.
The indocyanine green dye is actually a heavier molecule than fluorescein. So
Got the clue?
no, I don't think it really helps them. It helps them to fail, actually. Answer is option A, 2 to 4 minutes. Only 31% could answer, 31 persons. Percent could answer this correctly. Okay. So that's a very pretty difficult question. Okay. So question number 19. Fluorescein sodium is metabolized by option A, liver only, option B, kidney only, option C, liver and kidney, option D, skin. Where does it get metabolized? Processing and
Do some patients complain of staining of the skin?
yes, of course, and extravasation of fluorescein is very, very discomfort. It causes lot of discomfort to the patient and lot of severe pain to the patient also.
Time up.
It is exclusively metabolized by liver only, okay, and excreted in the urine. Okay. Question number 20. Vascular arcades of capillaries around the foveal avascular zone are located at option A is nerve fiber layer, option B is inner nuclear layer, option C is outer plexiform layer, option D is outer nuclear layer. Where are these capillaries of vascular arcades of capillaries around the foveal avascular zone? So whenever you see an OCTA, it looks great. Okay, so looking at the foveal avascular zone or fundus fluorescein angiography also, you really feel good when you look at the foveal avascular zone. But where are these capillaries in a normal retina? Over. Again, it is the inner nuclear layer. Okay. So, question number 21. False about negative photopsia after cataract surgery is. These are the real menace patients. Most probably Rajesh must be knowing more about it because he operates on premium IOLs. Option A is decrease with time. Option B is it can be plotted on visual field. Option C is reverse optic capture relieves the symptoms. Option D is depends on the IOL design and material. The
You already
negative
gave a clue.
photopsia.
You already gave a clue. You gave a clue.
Yeah, I gave a clue, but it really does not help. You are wrong tracking most of the postgraduates. Time is up, and the answer is option D. Depends on the IOL material and design.
You already told that using premium IOLs. You already said when using premium IOLs.
No, no,
You
no.
gave the
This
clue.
is false. Actually, it does not depend on IOL material and design. Okay, so it does not depend. Okay, so look at carefully at the question. False about negative photopsia. It can be plotted on an visual field analyzer, and they usually decrease with time. Most of the times, a proper counseling will help the patient, and reverse optic capture relieves the symptoms. Surprisingly, okay. Yes. Clear lens extraction to treat high myopia was first performed by option A Barakar, option B Fucala, option C Snellen, option D Lance. Time has already started. Clear lens extraction to treat high myopia was first performed by యూజువల్గా ఏమవుతుందంటే పీజీలో ఉన్నప్పుడు మనం చదువుకొని ఇప్పుడు క్వశ్చన్ల కింద ఆన్సర్ క్వశ్చన్ల కింద అడిగి ఎక్కువ మంది ఆన్సర్ చెప్పలేదనుకో మనకు కూడా ఏంటంటే అందరూ మనలాగానే చదువుతున్నారని చెప్పని బాగానే ఉంటుంది. ఫీల్ గుడ్ ఫ్యాక్టర్.
రివర్స్ కూడా ఉంది. వాళ్ళు చెప్పగలిగితే వారిని అందరికీ ఇవన్నీ తెలుసా?
అది అది ఓకే. అది ఫీల్ అయ్యే వాళ్ళం చదువుతాం కదా. Time is up. Option B, Fucala was the answer. And the next question is carefully answer this. Question number 23. Which of the following orbital disease does not respect anatomical boundaries? No, people don't respect any boundaries, and this disease does not respect any anatomical boundaries. Option A, idiopathic orbital inflammatory disease. Option B, orbital hemangioma. Option C is preseptal cellulitis. Option D is dermoid cyst. I prepared this question and sent it to an orbital surgeon, first orbital surgeon in the country, and she told you did an excellent job. All the four are answers, so please change the question. So I changed the question. All the options I had to change.
Time up.
Time is up. And how many got correct answer?
You should tell the answer.
No.
62%.
62% got the correct answer. Option A, idiopathic orbital inflammatory disease won't respect the anatomical boundaries. Okay, so
Is it the same as pseudotumor?
no,
the
pseudotumor is an obsolete term. It is no longer used. Idiopathic orbital inflammatory disease is the only term that is right now. Previously, it was called pseudotumor of the orbit. So question number 24, brain tumors usually develop without causing papilledema in all of the following regions except. So which of the following disease causes papilledema? That is basically the question. Okay, so brain tumors usually develop without causing papilledema in all of the following regions except. Option A, pons. Option B, frontal lobe. Option C, pituitary gland. Option D, central white matter of cerebral hemispheres.
Time.
Time is up. Time is over. Option B, frontal lobe is the answer.
One question. What is Foster Kennedy syndrome?
Foster Kennedy syndrome is ipsilateral optic atrophy and contralateral.
Yeah, anybody, what is Foster Kennedy syndrome? Unilateral papilledema, right? Ask him.
So if you know about the Foster Kennedy syndrome and its pathogenesis, you can easily answer this question. So that's as simple as that. So frontal lobe tumors, so though they produce the papilledema at a later date because they have a lot of place to occupy before producing a papilledema. Okay, so they produce papilledema at a later date. Okay. So, but the tumors in the pons and all the other options, they don't produce papilledema. In normal corneas, the central endothelial cell density decreases at an average rate of option A 0.1%, option B 0.3%, option C 1%, option D 3%. The normal rate of loss of endothelial cells in normal corneas per year. So after we are born, we lose everything. We lose everything.
What is the normal density?
I don't know.
2400 cells per.
See, I am a very poor student and you know it and you ask me. Okay. Answer is option B 0.3%. And then next question is question number 26. Setting sun sign in hydrocephalus is due to compression of. You often see these kids photos in Facebook asking you to donate money to help them. Option A midbrain, option B pons, option C medulla oblongata, option D oculomotor nerves by the uncus. So setting sun sign in hydrocephalus is due to compression of which of the following? Mind you, all these are in your Parson only. I didn't get it from anywhere else. Parson and Jukaranov, the latest edition.
That one line which we omitted, you are asking.
Yeah, it's always like that. It's always like that. That one line which we forget only is asked by the examiner. Okay.
Time.
Time is up. And answer is A, midbrain. Question number 27. Which of the following is not a feature of mitochondrial inheritance? Look carefully the answers. Which of the following is not a feature of mitochondrial inheritance? So it is not seen in mitochondrial inheritance. Option A, heteroplasmy is seen. Option B, severity and age of the onset are variable. Option C, all children of affected mother are diseased. Option D, all children of affected father are disease free. So with Dasara festival coming up, the energy to any individual comes from the mother. Okay, that is the clue that I can
Is
give.
that a clue?
That is the clue.
That's the clue.
You get all your mitochondria from your mother. Period.
Time.
C. All children of affected mother are deceased.
You are giving the direct
Okay.
answer. Only 4.
That is false. That is false. All of them are not deceased. All of them are not diseased. Some of them can be normal. Because heteroplasmy is seen. Because heteroplasmy is seen, some of them can be normal. See, when a cell divides, the mitochondria don't divide on an equal basis. The diseased mitochondria may not be there in the ovum. Okay. '28. Axenfeld's anomaly and Reiter syndrome are due to retention of this one is not typed properly. Reiter syndrome are due to retention of option A, neural crest and endothelium. Option B, neural crest and mesenchyme. Option C, neural crest and ectoderm. Option D, mesoderm and endoderm. Anybody who has read about the syndrome can answer not only this question but also another question also, which will be in the pipeline.
No clues?
No clues. It's only for the people who read. You cannot go on giving the answer in an indirect way. That is injustice, gross injustice to merit, which we only have. Okay. Of course,
No
don't
clue
have.
needed.
Okay, don't have. We never worked hard. That is why we always give difficult questions. Neural crest and endoderm. That is the answer. Only 9% answered. Okay.
Previous slide.
Yes, endothelium. Neural crest and endothelium. Option A only. This slide was wrong. Okay, but not the option. Endothelium.
There was a mistake there.
Question number 29. The treatment options for Peters anomaly include all except. The treatment options of Peters anomaly include all except. Option A, penetrating keratoplasty. Option B, optical iridectomy. Option C, deep anterior lamellar keratoplasty. Option D, Boston K Pro.
Kind.
Answer is option C, deep anterior lamellar keratoplasty. Okay, because the endothelium is defective here, you need to do either a penetrating keratoplasty or a Boston K Pro, or if you have more chances of failure, then you have to go for an optical iridectomy. Okay, yes. Question number 30. Which of the following antiviral drug is a prodrug? Option A, acyclovir. Option B, valacyclovir. Option C, famciclovir. Option D, penciclovir. Which is a prodrug among them? Option C, famciclovir is the prodrug, and the active drug is actually the penciclovir. Famciclovir in the body gets converted into penciclovir and is the active molecule. So lip-shudge bodies in skin scrapings are seen in option A, herpes simplex infection, primary herpes simplex infection also involves the skin. Okay, and option B is herpes zoster ophthalmicus. Option C, ocular cicatricial pemphigoid. Option D is Steven Johnson syndrome. Lip-shudge bodies in skin scrapings are seen in. They are in the intracytoplasmic inclusion bodies. It's over. Answer is B, herpes zoster ophthalmicus. Question number 32. Which drug among these cause macular edema that shows leakage on FFA? So, 3 out of the 4 drugs cause a cystoid macular edema that doesn't show leakage. Okay, so only one of them shows leakage on FFA. Option A, taxanes, docetaxel, paclitaxel, all these taxanes. Option B is prostaglandin analogs. Option C is epinephrine. Option D is niacin. It's over, time is over. So there is obviously a long list of drugs that cause cystoid macular edema without causing leakage. Okay, so I was also surprised. Option B, PG analogs. Question number 33. Fluorescent dye first enters the eye through option A, short posterior ciliary arteries. Option B, central retinal artery. Option C, long posterior ciliary arteries. Option D, anterior ciliary arteries. I read my anatomy long back.
No,
Are there any long posterior ciliary arteries? There are. Okay.
if you know the phases of FFA.
You should know the phases. Yes. Ought to know the phases, isn't it? option A, short posterior ciliary arteries is the answer. Question number 34. Bilateral oculomotor nerve palsy is seen in option A, tuberculous basal meningitis, option B, syphilitic basal meningitis, option C, sarcoidosis, option D, Lyme disease. Bilateral oculomotor nerve palsy is seen in.
Time.
Time is over. Option B, syphilitic basal meningitis. That is the point of differentiation between syphilitic basal meningitis and tuberculous basal meningitis. Okay. So, question number 35. Copoc cataract is due to expression of option A, gene, option B, pseudogene, option C, viral genome, option D, prions. Have you heard of this cataract? Copoc cataract. It's a congenital cataract that occurs in the embryonic nucleus. A lot is happening in genetics. That is why I wantedly kept 2 or more questions on genetics and other aspects. Time is up. It is option B, pseudogene is the answer. Question number 36. Lambda sign and panda sign. Lambda sign and panda sign of systemic sarcoidosis are seen in which of the following investigations? Option A, HRCT of chest and skull with IV contrast. Option B, MRI chest and skull with IV contrast. Option C, gallium 67 scan. Option D, FDG PET scan. FDG PET scan obviously uses glucose. Done. The answer is option C, gallium 67 scan. This is a highly specific and sensitive scan. Question number 37. Medullated corneal nerves. It is not nerve fibers. Medullated corneal nerves are seen in option A, systemic lupus erythematosus. Option B, multiple endocrine neoplasia 2B. Option C, sarcoidosis. Option D, congenital rubella syndrome.
How will they appear on the cornea? What do you look in the slit lamp?
They appear throughout the cornea, isn't it?
I'm not sure.
Okay. మీ అంత బాగా చదవలేదని చెప్పాను కదా నేను ఆల్రెడీ.
నాకే తెలియదు అంటున్నా కదా.
అదే కదా మరి. ఇప్పుడు జోగి జోగి రాసుకుంటే ఏమి రాలుతుంది? బాగా చదివిన అమ్మాయిలను ఎవరినన్ను అడిగితే వాళ్ళు చెప్తారు ఆన్సర్లు. మన అబ్బాయిలము మనం ఏమి ఎట్లనే ఉండాలి అంతే. డన్. The answer is multiple endocrine neoplasia 2B. Question number 38. We are coming to the last 3 questions. Which of the following is false about juvenile primary open angle glaucoma?
False.
False. false about juvenile primary open angle glaucoma. So which is not seen, which is okay. Option A, autosomal dominant inheritance is seen. Option B, long arm of chromosome 21 is anomalous. Option C, CYP1B1 gene is most commonly associated. Option D, steroid responsiveness is seen. Juvenile primary open angle glaucoma occurs in young individuals, and it is very, very important to recognize this and treat this. 10 to 35 years, juvenile primary open angle glaucoma, almost people of your age. Okay, so you have to respect their breadwinning capacity, and you have to respect, you have to really preserve their sight so that their life will be as normal as possible. Time is over, and CYP1B1 gene is most commonly associated with congenital glaucomas, not with juvenile primary open angle glaucomas. Question number 39. Maternal ingestion of phenytoin has been implicated in babies born with option A, coloboma of the optic disc, option B, optic disc coloboma. So, sorry, both options are duplicated, isn't it? Okay. Optic disc pit and optic nerve head hypoplasia. Let us keep this out of the competition. Okay. This question will not be calculated for the.
What is phenytoin given for? Phenytoin. Seizures, good.
Optic nerve head hypoplasia occurs in children born with mothers who have taken phenytoin. Question number 40. Which is false about ethambutol toxic optic neuropathy? This is a very, very important question, and I asked this with a purpose. Okay. Option A, it is dose related. Option B, 15 milligrams per kg per day is the upper margin of safety. Option C, it is irreversible from early stages. Option D, color vision is affected. Which is false? This is where the cases are rising, and they are rising at an alarming rate, and all of you need to know this. This ethambutol toxicity, if you don't know it, you will be messing up with people's lives. We have seen in our own OPs, young people, breadwinner of the family or breadwinner for themselves, around 25 years of age, losing sight because of ethambutol. Both eyes going blind. 25-year-old young man. Okay, how will they survive?
Don't you think option A and B are the same? You're asking about the dose only.
Yeah, it is dose related, but whether the correct dose is 15 milligrams or not, that is the twist there. Okay, so time is up. Okay, so both option A and B are seen actually. It is dose related, and the dose is correct, 15 milligrams per kg per day, and it is actually color vision is affected, and it is reversible in the early stages. Early stages, if you find any patient with ethambutol toxicity, you will be able to save his eyesight. Very, very important point to take home. Okay, so option C is the answer, and I thank all of you for the active participation. Hope I have done justification to my job. Result. Soumya Priya Ellamati, 25 out of 40. Congratulations. Your prize will be given in Tirupati. So please do come to Tirupati APOC. Where are you from, madam? Srikakulam Gems. Very good. GMC. So there is RIMS Srikakulam. Okay, okay. RIMS is different from GEM. Okay. GEMS is private. Okay, okay. Yeah, RIMS Srikakulam. She is a student of RIMS. RIMS Srikakulam. What does GMC mean? Government Medical College. Okay. There are three prizes, and the first prize belongs to Soumya Priya, and second one is Reshma Jose. Who is she? Reshma Jose. Wow, very good. GMC
Claps, everybody.
Srikakulam. Hearty congratulations. And Rahul Gogineni, I cannot give you the prize. Okay, so that will be only considered by the APOC. Okay, so who is YS Sahiti? Okay, okay,
Same
okay.
college.
Same college. Very good, madam. Hearty congratulations to you, madam. You are the winner. You are the winner. Thank you all for active participation.